Good evening, you're watching News Mongolian MNB World. I'm your host, André Batter. And for our top stories, Ministry of Health reports that patients with the Omicron variant may only display influenza-like mild symptoms. The Mongolian Red Cross Society has donated 50,000 PCR tests to the Ministry of Health. 2010 local cases, 25 imported cases, and 3 additional deaths reported. And for other news, stay tuned. The Ministry of Health and the National Center for Communicable Diseases warned that when the Omicron variant is expected to be at its peak in Mongolia in February, 18 to 20,000 daily cases of COVID-19 might be recorded. As the number of COVID-19 cases is growing day by day, we have received some clarification from related officials.
The Ministry of Health today reported that 2010 new COVID-19 cases were detected after tests were carried out at PCR laboratories across the country. 3 people, 2 women and 1 man, all with underlying health conditions, died of COVID-19 complications in the past 24 hours. All new cases except 25 imported ones were confirmed domestically, out of which 1,454 were confirmed in Ulaanbaatar and 531 were confirmed in the provinces. 5,889 COVID-19 patients are being treated at hospitals nationwide. Additionally, 22,221 patients are being treated at home. Among the COVID-19 patients being treated at hospitals nationwide, 1,692 are showing mild symptoms of illness and 35 are in critical condition. As of now, around 2.17 million people have had 2 doses of COVID-19 vaccine and 29.4% of the population has received the booster shot so far. The anticipated COVID-19 peak is to be reached around Lunar New Year. Hence, officials warn the public against the risk of getting exposed to the virus, and it is advising people not to celebrate the holiday widely.
The Ministry of Health and the National Center for Communicable Diseases warned that when the Omicron variant is expected to be at its peak in Mongolia in February, 18 to 20,000 daily cases of COVID-19 might be recorded. As the number of COVID-19 cases is growing day by day, we have received some clarification from related officials.
Lately, around 2,200 new cases of COVID-19 have been recorded daily. According to the studies at the NCCD, about 60 to 70% of these cases are caused by the Omicron variant. But as we have observed, the symptoms are usually quite mild, and there are about 5,000 patients with mild symptoms undergoing treatment at the NCCD, and only about 30 people are displaying critical conditions. We remember that during the Delta variant peak, around 300 patients with severe symptoms were undergoing treatment at the NCCD. So we are assuming that the Omicron variant symptoms are comparatively mild, more like influenza. When it comes to our country, the majority of people have been administered 2 doses of vaccines, and people were infected during the first 2 waves, so we assume that there is also a great deal of herd immunity among the population. Patients with mild symptoms should observe their general health state, use fever drugs if they have a fever, consume warm drinks and hot meals, and isolate themselves. The Omicron variant does not cause pneumonia like Delta did, and therefore international medical teams and local medical teams are treating patients with influenza drugs. For example, Spain has announced that it will treat COVID-19 patients with the Omicron variant with influenza drugs. We have prepared 5,000 to 6,000 beds for possibility of receiving more infected people.
The number of Omicron cases is expected to grow in the upcoming days. The Ministry of Health warns citizens to keep practicing and maintaining preventive measures like wearing masks, practicing social distancing, getting booster shots, and not attending events with mass gatherings.
The Mongolian Red Cross Society has organized an event to donate 50,000 PCR test kits to the Ministry of Health on January 13th. The Secretary General of the Mongolian Red Cross Society, Bolorma, provided us some commentaries.
Could you give us some more information about bringing the PCR tests into Mongolia?
The Mongolian Red Cross Society has been working actively with the Ministry of Health and its affiliates since COVID-19 was confirmed in Mongolia back in 2020. The 4th wave of the pandemic is underway and COVID-19 Omicron variant has been confirmed. At that time, we immediately conducted the Chinese Red Cross Society and they have donated 50,000 PCR test kits to Mongolia. And we work closely with other countries' Red Cross societies. Since the beginning of the pandemic, a total of 4.8 billion MNT has been spent on inventory and cash payments. We are working in three main areas, the first of which is to support the health sector to help strengthen their capacity and to support the families of medical workers. Second, food support was provided to families with many children whose income dropped drastically due to quarantine. So far, more than 37,000 food packages have been distributed. Our third area is training volunteers. About 500 volunteers were trained in classroom and online training was conducted. These volunteers are working with epidemiologists at National Center for Communicable Disease when the workload is high and number of COVID-19 cases is increasing. They are very active and helpful. Volunteers also help prepare medicine packages, deliver the packages to households, and provide counseling by telephone.
In recent time, what projects and collaborations is the Mongolian Red Cross Society working on?
We are preparing to organize an online conference on January 26 for donors to learn about the COVID-19 pandemic status and what support we might need in the future. We have entered into a cooperation agreement with the Ministry of Health for the last 6 years and make annual plans of action. The Red Cross works very well together to fight tuberculosis. In particular, tuberculosis screening is provided every quarter for those who don't have a specific home address. We also have work to do fight AIDS, so we have a responsibility to help the government in this field. Last year, we spent 2.4 billion MNT on humanitarian assistance to herders and families affected by natural disasters. We work with the Ministry of Health and Emergency Management Agency to exchange information on a daily basis.
Now let's take a look at Mongolia's current affairs.
Ambassador Extraordinary and Plenipotentiary of Mongolia to the Republic of Austria Zingig presented his letter of credence to President of Austria Alexander van der Bellen on January 12th. Conveying the greetings of President of Mongolia Khrushchev, the ambassador talked with the Austrian president about expanding the friendly relations and cooperations between the two countries in economic, environmental, and humanitarian areas. President Alexander van der Bellen expressed his pleasure with the expansion of bilateral relations and wished the ambassador success in his endeavors. The Ministry of Environment and Tourism, the Ministry of Energy, and the Ulaanbaatar mayor were directed to create a working group in charge of re-examining the quality of refined coal briquettes backed up by laboratory tests. The results will be discussed and are to be introduced to the government as soon as possible. Also arranging the repair project for the THAILAND LLC's first briquette factory of Western region, which was set on fire recently, was assigned to the Energy Minister Tevenbich and THAILAND LLC's CEO Gambatar. The financing of the repair project was tasked to be resolved by the board directors of Ertnes THAILAND LLC.
Here's the currency exchange rate provided by Mongol Bank. Here's the weather forecast of world's major cities. Well, that's all for today, and thank you for staying with us. We will see you next week with more news and updates. Have a nice evening. Goodbye.